everyone, welcome back. We have such a fun video today because I'm joined by Dr. Shah. He is a dermatology resident and one of our favorite TikTok dermatologists. And today we're gonna talk about dangerous skincare TikTok trends. Dr. Shah, are you ready?
I have so many things I wanna say about this topic, and there's a lot of myths to debunk out there, so let's do it.
So we have compiled a list that we commonly see on TikTok that we really just want people to stop doing. All right, so let's hit number one, and it is baking soda on the skin. What do you think about this trend?
I think the idea that baking soda is going to be good for your skin is a little bit ridiculous. I mean, it does have beneficial properties and things like cleaning your teeth and cleaning things, but at the end of the day, it's not neutral to the pH of your pH of your skin is naturally acidic. And you have that acid mantle of the skin that runs anywhere from 4.5 to 6.0 pH, whereas the pH of baking soda is 8+. And a lot of people are under the impression that acids burn your skin worse than bases, but it's actually the opposite. The only acid that burns your skin worse than a base is actually hydrofluoric acid. And so bases are horrible for disrupting your lipid barrier of your skin. And so when people put baking soda on their skin, they're really damaging their skin more than they probably realize.
They're using baking soda to cleanse? Is it to exfoliate? Do we even know why they're choosing baking soda?
I never know why they're choosing this. They use it as a mask or they use it to scrub their face. I don't know if it's cleaning. I don't know if they're trying to clean their pores. It usually just starts with one video and then everyone kind of mimics it and then it spins out of control and we don't even know why it started in the first place.
The thing that I've noticed with like teenagers and people that are a little bit younger or people that have acneic skin or oily skin, they tend to think that over cleansing and stripping their skin is the way to get rid of the oil or the acne that they have, right?
That's absolutely true. I think people have the idea that their skin is dirty and that's why they're getting acne or they have a lot of oil production, but it's actually the opposite. You have this bacteria that grows on everybody's skin. So scrubbing your skin is not going to make it better. It's just going to irritate it, cause inflammation, which is one of the causes of acne in the first place is inflammation. So you're not really going to be helping your skin. You're just going to be making your skin worse. And if you strip those oils away, your body is like, I need to make more oil. So it actually is going to make it worse in the long term. So I do get a lot of people that ask me like, what's the best scrub for my face? Well, it's no scrub. You don't need to scrub your face. You just need to, be gentle to your skin.
All right. So that brings us to skincare trend number 2 that we don't want to see. And that is microneedling at home. What do you think about this?
This is one of the ones that leans on like very dangerous to me is the idea that you should microneedle at home. Well, we know microneedling is beneficial to the skin. So I'm not saying that microneedling is not good. We use it in our office all the time. We poke little holes in the skin and it ends up boosting collagen. It helps with dark spots, helps with wrinkles. So microneedling has a lot of benefits. So I don't want to, hate on microneedling in general. What I want to say is doing these things at home, you're poking little holes in your skin. And your skin barrier is the thing that is basically protecting you from everything in the environment. It's protecting you from infections. It's protecting you from allergens in your skin. And when you poke little holes in the stratum corneum, which is the top layer of your skin, you allow those bacteria to get into the skin and you could cause a really bad infection of the skin that would require hospitalization or IV antibiotics. It could be really dangerous.
I think a lot of people don't realize whenever I say like, I don't really like microneedling at home. One of the things that I tend to point out is that when you get it done at, say, a dermatologist's office, it's being done in a very controlled pattern and manner, right?
Right. So we have it spaced out, very well. It's even punctures to the skin. We're controlling the depth of the needles to make sure that it's appropriate for that part of the skin surface because not the entire skin is the same depth on the whole face. And so you have to be very careful with how you're using these needles, and you definitely want to make sure you clean the skin. But if you're trained to clean the skin and use microneedling by an esthetician or a dermatologist, and you know exactly what you're doing, then I want to empower everybody to do everything at home. I'm not against that, but I think the safety issue just becomes super concerning to me.
These tiny little punctures could actually become very dangerous. And the difference with getting it done at a doctor's office or even an esthetician's office is that you are trained to handle it if it gets to that point, right?
Exactly, yeah. You need the training, especially, if something goes wrong and you end up having a bad outcome. Basically, you're in a setting where they can fix it and you have somebody that you can call to get in with. And so it's just important to have safety. I think safety is just the biggest thing that I can stress, because like I said, I see the negative outcomes of this. I worked in the hospital for a long time, so I see when everything goes absolutely wrong, and it can be really, really bad. And a lot of people don't realize that once you break that barrier to your skin, it's so hard to restore that barrier. Anybody that's had an allergic reaction to a skincare product knows this. Anybody that's had an infection on their face knows this. It's so hard to get back to zero once you go the wrong direction. And so I've suffered from that too, where I've ended up with an allergic reaction to a product, and it's just months before you get back to where you started. And so it's so important not to do things like that.
So some of the clips that we pulled, there were people using the derma roller and then using a pen and then also using a stamp. Are all three of them essentially the same thing? Like, don't do it at home if you're not trained for it?
Yeah, exactly. And I've seen some people kind of show examples of the derma roller and how it creates uneven punctures in the skin versus the stamp, which is a little bit more even. I think at the end of the day, for me, the safety just comes from putting holes in the skin in the first place at home and introducing infection and allergen into the skin. Plus, people will microstamp skincare products into their face, which we don't even know if those things belong deep in the skin. And so it really is not good, especially, some of these products are exposed to air as well. So they could be colonized with bacteria as well. And then you stamp them into your skin. That's very, very dangerous.
Yeah, I hadn't even thought about that. Good point. How about the cleanliness of these tools at home? I know that some people tend to reuse their microneedles when they're doing it at home.
Yeah, I saw that in one of the videos where somebody was using like an antiseptic spray that I think it was alcohol in it, which is a good antiseptic. But in our office, we use disposable tips. So it's a single use, you use it, you throw it away. And that's the best way to do it because it's sterile at the time. So even if you use an alcohol cleansing, you could have things that are resistant to alcohol on it. You could have fungal organisms on it that you're stamping into your skin. And so it's really just not worth it, because if you end up worse off than when you started, you're really going to hate yourself for it. And so it's just, even if you do it properly, it's best to, if you're going to do it, it's best to throw it out and use a new one every time.
Is there also something to be said about not doing it too often as well? So if you're doing it at home and you're trying to do it like every single day, that could be a problem, right?
Yeah, I think that's true for any procedure where you're basically breaking the skin in order to bring in growth factors. And so that's going to apply for things like dermaplaning, microdermabrasion, microneedling. These are things you want to do once a month maximum. You don't want to do more than that because you're basically causing damage to your skin, but it's like controlled damage to your skin. And so that's helpful for bringing in growth factors and resurfacing and building collagen. But if you do it too much, it can cause a lot of irritation and inflammation, and it doesn't give your body enough time to heal the wounds that you created. And so these are things you do once a month to once every 3 months.
All right, so we're moving on to one of my favorite topics, and that is DIY face masks. This is a trend that we have seen for so long. People are really into it. And I've definitely done this at home, where I've gone into my kitchen and I've chosen some items that somebody told me were really good for my skin at some point. And then I put them on my face only to find out they either, did nothing or they irritated my skin. What do you think about this trend?
I'm very much against DIY skincare. And it sounds bad because, you want to empower people to do things themselves and not have to buy skincare products. But if I could find something that I could recommend to you, I would gladly recommend these things to people. But it's just like you said, like you're kind of mixing all these things together. And I asked people, why do people like doing this? And they said it's kind of like cooking. You get to make your own recipe, and then whatever outcome it is something you made. And so people like that. There's a couple things that, I think are probably okay for the skin. They're not like honey. It's probably not going to cause you a lot of damage. Probably not going to cause you a lot of benefit. I mean, it does have like antibacterial properties, but it's probably harmless. Turmeric, it's going to cause your skin to be yellow, but it's probably not going to be harmful to the skin. So there are a few things that people are doing that I'm just like, well, if you like it and, it's something that's built into your culture, I'm South Asian. And so for our culture, turmeric is like a big thing in our culture. But it's when people start to put things together like the ginger pore masks or, cayenne pepper on the skin, or paint on the skin, or glue on the skin. It's things like that where it starts to get into the, not just like this is fun, but this could potentially be dangerous. And so that's why I'm pretty much against it. Plus, I think people, when you see them come into my office, like I realize that people are desperate for results. Like they have skin conditions and they want to get better. They want their acne to get better. They want their skin to be perfect. And then you start doing all these things that you think are going to work for you, but they actually have no proven benefits to the skin. And so it's harmful in a way that even if it's not harming your skin, you're also not like seeing benefits. And so you're just lost time of things that you could be doing that would be benefiting your skin in order to do these DIY masks that are going to do nothing for you.
Yeah, one of the things that I kind of see when people are asking me about these at-home ingredients and stuff to put on their face, like lemon juice, for instance, I think in their minds, they're like, well, how harsh could this be for my skin because this is something that I can eat? And I hear that argument a lot. Like, if you can eat it, it should be safe for your skin too. What do you think about that?
It's a good thought in theory. There's a lot of beneficial things that are extracted from lemons and extracted from limes and oranges that we can use, like the vitamin C. The vitamin C that comes from these things could be, if formulated properly, could be beneficial. But the way that they are, it's very acidic. Lemons are very acidic, and our stomach is very acidic as well. And so just because you can eat something, like, you wouldn't want to put stomach juices on your face. I mean, it would burn your face. So there's a lot of hydrochloric acid in your stomach, and so just because you can eat it doesn't mean it's good for the skin or beneficial to the skin. Your gut lining is much different than your skin.
Yeah, definitely a good point. I would not put stomach acids on my face. I hadn't even considered that.
Yeah, and there's another thing with limes a lot of people don't realize is we have like a diagnosis in dermatology. It's called like beer drinker's dermatitis, where basically one of the ingredients that are in limes and other citrus fruits, furocoumarins, can cause a reaction called phytophotodermatitis, where the sun hits that ingredient and basically causes a phototoxic reaction. You can end up with like these really dark, hyperpigmented like areas on your skin that take like almost a year to fade. So just because it's a natural ingredient doesn't mean it can't lead to a toxic reaction in the body.
Yeah, that's something that you can also get from, some essential oils, right?
Yeah, absolutely. And it's because they're extracted a lot of times from these like citrus containing plants that have these furocoumarins in them. So you can definitely get that from your essential oils.
How about something like cayenne pepper, for instance? Or, I see like coffee grounds, which we know scrubs are just not something that we really want to be putting on our skin. But what do you think of those types of harsh ingredients?
Correct me if I'm wrong, but I think a lot of people are under the impression that if it burns, like, it's working, and I'm like very much the opposite. If it burns, I start to panic that, something has gone wrong and that I need to immediately wash it off my face. Skincare ingredients sometimes in controlled settings can tingle a little bit. They can cause a little discomfort, but they shouldn't like burn. And, cayenne pepper can burn you. And then people are like, wow, I'm getting this like, my pores are shrunk. Well, your pores are shrunk because you have a ton of inflammation that's now just squeezed the life out of your pores from all that inflammation. And so you're really not getting a benefit from those things, but it can temporarily look like you are. And so cayenne pepper, coffee scrubs, coffee scrubs are basically just St. Ives walnut scrub to me. So,
Yep.
Yeah, we all know the story of that.
So speaking about this DIY, face mask trend, there are also other DIY ingredients. Like, have you seen toothpaste for acne?
Yeah, toothpaste for acne. This is like one of those things I was told as a kid, oh, you got a pimple, just put some toothpaste on it. It's going to clear up overnight for you. And there may be a little bit of truth in the past to that, because there was an ingredient that was in old toothpaste called triclosan. Triclosan used to be in your hand soaps. It was everywhere. It was like in every at-home skincare product that had antibacterial properties. And so it used to be in toothpaste in the United States. And that could fight maybe some of the bacteria that was in, a pimple. But now they've removed it. Basically, the FDA a few years ago said this is a harmful ingredient. Let's not use it anymore in any products. And so we've removed it from toothpaste. And so now people are just putting basically toothpaste on their skin with no benefit. It's made for your teeth. It's supposed to clean your teeth. So we know just those ingredients are going to be harmful to the skin. Anything that can remove plaque from your teeth should probably not be on your face.
I actually did not know that about triclosan, that it was an ingredient that dried out pimples back in the day, but it's now removed. I had no idea. Could they get any other damage maybe from using toothpaste on their pimples right now? Like any of the whitening toothpaste, for instance, or anything with like fluoride in it, could that be damaging?
Yeah, so there's some question about whether or not the fluoride can cause like almost like a perioral dermatitis, where you get these like little red bumps around the chin, around the mouth, whether or not fluoride plays a role in that. And so potentially you could cause some type of reaction, but it depends. Every toothpaste is sort of different in what they put in their ingredients. But Some have baking soda in them. So we talked about baking soda already. So, it has all of these different types of ingredients that are meant for your mouth to, kill bacteria in your mouth and, clean your teeth. And so it really just depends on the formulation. But I think fluoride has been questioned whether or not it causes perioral dermatitis.
Another one that I have seen for acne is hydrocortisone. Why is that a problem?
The biggest problem with hydrocortisone is that it's like a trick, because it's gonna work. Like you're gonna put it on your pimple and it's gonna immediately disappear, like within a few hours. And you're gonna say, wow, this thing is working and I'm gonna keep doing it. And that's probably one of the most dangerous things, is something that works, but is actually causing damage to your skin. And so we're probably the top prescribers of steroids in the world as dermatologists in general. We prescribe a lot of topical steroids. And so we know how to use them safely. We know how to use them unsafely. And we know that we don't want to be using steroids for a long period of time. And we've seen multiple studies that have shown that over time, steroids on the skin cause atrophy of the skin, so thinning of the skin. It causes prominent blood vessels in the skin. It causes a lot of times irreversible damage to your skin. And so that's why hydrocortisone is so dangerous, is because it decreases inflammation. You're going to see your pimples sort of melt away, but you haven't actually addressed the underlying cause of the pimple, which is the bacteria, the inflammation, the skin cells that are sticking together. You haven't solved any of those problems, but you've stopped the inflammation temporarily. So your acne is going to get worse. You could potentially get perioral dermatitis, which is very commonly caused by steroids. And that can affect around the eyes. It can also affect around the mouth. We call that periorificial dermatitis when it affects both areas. So steroids can be very, very damaging to the skin, but they will make your pimples look better for a few hours, which is scary.
And then one more of the DIY skincare ingredients, and that is apple cider. More so I see apple cider being used as a toner, but people will use it in everything. They'll use it as a mask. They'll use it as a spot treatment. They use it all over the place in skincare. What do you think about that?
Yeah, people drink it too, like for, different ailments, and they swear by it. So apple cider vinegar is sort of an interesting skincare ingredient. A lot of people will swear by the benefits of it, but at the same time, it's one of those things that's pretty acidic to the skin, and way overpromises, similar to like what I think about CBD oil, is that maybe there's some benefit to it, but at the end of the day, these things are like way overpromising that they're going to cure basically everything from hyperpigmentation to acne to rosacea. But at the end of the day, it probably is similar to any acid in the skin. It's going to help exfoliate the skin maybe a little bit. But at the same time, I think it's too acidic for the skin. And so if you dilute it, maybe, but then at the same time, you don't even know how reliable the formulation of ACV you're getting from whatever store you bought it from. And so I would just stay away from things that have unreliable pHs that could potentially be damaging to the skin. Have you ever tried it?
I actually have, and it burns a lot. And, I can use really strong glycolic acid and, like any kind of, HAs, BHA and stuff. And when I put the apple cider vinegar on my skin, I was like, get this off. And it smells bad too.
I think that it's probably one of the less harmful things, but at the same time, if you're gonna use it, definitely dilute it with water, at least 1-to-1, where you have 1 part water, 1 part apple cider vinegar. But you're really not going to see like a long-term benefit. Like if you want to see improvement in your skin, don't use ingredients like this. Is it going to cause too much harm? Probably not too much harm, but you're also not going to see any benefits. So that's harmful in my opinion.
Another one that I've seen is the dental floss, specifically that, the dental floss tool to extract clogged pores. What do you think about that?
It's sort of like the spatula to me. You kind of sort of push out all of this sebaceous gunk that builds up in there over time. It's something that's going to cause a lot of friction on the skin. It's going to potentially cause wrinkles like we talked about, but it could also disrupt the skin barrier as well and lead to inflammation. But those types of procedures, they are a one and done type of thing. You scrape out all the gunk that builds up and then you're back where, what are you going to do next, basically? So, use ingredients like, your salicylic acid that's going to actually help try to control the underlying problem, rather than use something like this where you're just extracting, causing damage to your skin. Yeah, you remove some of the sebaceous gunk, but you're still no off better than when you started.
I keep hearing you say inflammation, right? And I think a lot of people think of inflammation as just redness that they get from their skin. But what would be the reason to try to avoid inflammation with all of these types of, treatments, at-home treatments?
We look at inflammation as, it could be either painful, it could be redness, it could be like a myriad of things. It could be just fluid that comes in and there's no redness at all. But when you get inflammation, what ends up happening is you disrupt your skin barrier, and so you get the potential for allergens to come in. You also bring immune cells in that could potentially see something in that skincare product and then create a sensitization and then an allergic reaction, because it takes that skincare product, presents it to your immune cells, and then you end up getting an inflammatory reaction that's even worse than before. And so it's not just redness and irritation. There's like a lot more that goes on to inflammation that can end up causing wrinkles in your skin. It can damage collagen, it can damage elastic fibers, and then it can also end up leading to worsening allergic reactions further on down the line.
Could you also get broken blood vessels with this type of treatment as well?
Something like that, similar to the pore vacuum, similar to the spatulas, it's going to create broken blood vessels, potentially, where you could get the broken capillaries that could lead to telangiectasias that you would end up needing a laser treatment. So yeah, you definitely want to just be gentle to your skin, be kind to your skin.
Baby
it's something that you want to protect, and that's why we wear sunscreen. And so, a lot of things from the sun are caused by inflammation too, where you just get an inflammatory reaction. And so same thing, you don't want to cause inflammation on the skin.
All right, and then the last one that I think we just see on social media in general, and that's that people take, one source of information, maybe like one authority on skincare, and then they basically just apply it to themselves without doing their own research. What do you think about that?
Common misconception, nobody has a monopoly on skincare advice. Not dermatologists, like nobody is the be all end all of skincare. So you definitely have to do your own research. Everybody has different skincare problems that they need to address. And skincare, like you said before, is so personal to people. It's something that is your skin, and your skin, it's like a fingerprint. It's like nobody else's skin is going to be exactly like your skin. And so I see a lot of people that see somebody that they admire and that they like, and then they go and they say, well, I'm going to use their skincare routine. Well, it's like they have, combination skin and they don't get any acne, and you have acne or you have hyperpigmentation. Well, you need to address your skincare problems, not their skincare problems. And so copying people's skincare routines, or kind of over trusting somebody that you admire without doing your own research to make sure that it's safe for you. For example, people with different skin tones are more prone to hyperpigmentation if you have darker skin. And so if you are using something that could be inflammatory on the skin, like glycolic acid, and you have darker skin, well, it might be safe if you have lighter skin, but if you have darker skin, you can end up with hyperpigmentation. And so all those factors are so important. It's got to be really personalized to you.
I think it's really important that people, go see a professional like you, and then maybe figure out what's going on with their skin too. Because I think that's the other issue, is they'll see, somebody maybe even has something that they think is very similar. I think fungal acne, you brought that up earlier. That's a very common one where, it's like, I feel like one person will say they have fungal acne and it seems very similar to what somebody else is experiencing. So they just automatically assume it's fungal acne.
Yeah, I spent a lot of time telling people they don't have fungal acne. That's become like the new thing. Very similar to, fungal acne or malassezia folliculitis, which is, technically the proper term for it. It's become this sort of social media phenomenon where there are little bumps on the skin. Well, there are a lot of reasons to have little bumps on the skin, from regular acne to fungal acne to, genetic disorders can cause little bumps on the skin. So it's really important to know that you're treating something the right way, even if you think it's the same, especially if you're not responding to initial treatments that are very common for something. For example, if you have acne and you're not responding to salicylic acid or retinoids, maybe it's time to consider maybe you have something else. Or if you have, fungal acne and you're not responding to ketoconazole, well, maybe it's not fungal acne, maybe it's something else. And so definitely getting the right diagnosis is super important, especially if you want to see progress, because if you're treating the wrong thing for a month, it's not going to get any better.
Especially things like acne, if you don't treat it soon enough, it can lead to things like scars, right?
Yeah, so that's another really important thing, is we sort of need to understand the limits of, first, what topical medications can do in general. Or non-prescription medications can do in general. There's sort of a limit, and people need to understand that if they have scarring acne or they have nodular cystic acne, that no topical medication is going to touch that. And so if you're getting scarring, you need to treat that immediately, because scarring is very difficult to treat, whereas acne is actually pretty simple to treat, especially if you see a dermatologist. We have really powerful medications that we can give you that can clear your acne almost certainly. But scarring, on the other hand, anybody that has acne scarring knows, very, very difficult to treat compared to just, regular acne is. So
I think there was like a common theme with some of these, at-home treatments that we saw in, all these clips and stuff. And that's that people are trying to deal with acne and they're trying to deal with maybe oily skin. Do you have, ingredients that you prefer?
For acne, top 3, if you are trying to treat your acne at home and you don't have one of these 3 ingredients, then I don't think you're really treating your acne. You either need to have a benzoyl peroxide, which is an antibacterial. It's going to help with your inflammatory acne. You need a retinoid with something like Differin or adapalene gel that's going to target a lot of the problems that cause acne, or salicylic acid that's going to try to break down some of those comedones as well. So I think you need one of those 3 things if you're going to treat acne truly. And if you're pregnant, then azelaic acid is a good substitution for those 3 ingredients. So 3 or 4, those 3 or 4 are really important for just treating acne at home. If you're not having those in your skincare, which I see a lot of people do, they say, I'm using all these skincare ingredients and my skin's not getting any better. And then I look at their skincare products and I realize they don't have anything that's actually fighting acne. And so you definitely look for those 3 or 4 ingredients in your skincare products. And then I guess for oily skin, you mentioned salicylic acid is great for oily skin, retinoids are great for oily skin, and niacinamide is an ingredient that is awesome for oily skin. It's been proven in certain studies to decrease sebum production or oil production in the skin.
Well, thank you, Dr. Shah. This was so much fun. I hope that, people learned a lot from this video, and I hope we get you back sometime soon.
Yeah, absolutely. Thank you for having me. Thank you for allowing me to come on your channel and talk about these skincare myths that I'm super passionate about, and hopefully it reaches somebody and they stop doing these things.
All right, so Dr. Shah, tell everybody where they can find you on social media.
So I'm active on TikTok at Derm Doctor, and you can find me on Instagram at Dr. Lee, so different names between the 2 platforms, and then on YouTube at Dr. Lee as well. So pretty active on those platforms. If you guys have any questions, you can always send me a message. I'll do my best to respond, but yeah, try to find me and I'll keep trying to educate you guys.
I will leave all of his information in the description box. You can find me on Instagram at Susan Yara, and we'll talk to you guys soon. Bye.